This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Are you tired of logging into multiple systems and duplicating your work? Managing your practice's payments can be complex and time-consuming. But it doesn't have to be. With Dr. Chrono, you can have access to our payments feature, which is fully integrated, so you save time and get paid faster. A game changer for medical practices. With Dr. Chrono Payments, you can process more payments, minimize administrative tasks, and streamline your workflows. Streamline the payment process and improve revenue streams in one unified platform. Visit drchrono.com/revenue-cycle-management today to see how Dr. Chrono Payments can transform your practice. Elation Health wants to support all those looking to start their own DPC practice. For that, they created a checklist for how to launch your own practice. Learn everything you need to know about planning to open a new DPC practice, from Medicare opt-out requirements to legal advice, financial support to marketing know-how, and the technology resources available to DPC physicians. With Elation's EHR, ensure your patients receive high-quality, proactive care through an intuitive clinical workflow while reducing manual work and charting time. Elation Health's EHR supports you throughout all stages of your DPC journey. Visit elationhealth.com/mydpcstory to download today. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
Direct primary care is more time for what matters. It's more time for patients, time for our team, time for my family, time for my health, relationships, my professional journey. I am Dr. Phil Boucher of Frontier Pediatric Care, and this is my DPC story.
Dr. Phil Boucher is a DPC pediatrician in Lincoln, Nebraska. He opened his state's first and only pediatric DPC in 2022 and has grown to over 600 pediatric members. Dr. Phil and his wife, Catherine, have 6 kids, 3 dogs, and 2 bunnies. He also loves helping DPC docs start, grow, and automate their practice marketing, and started a new medical software CRM called Practice Leads to help busy DPC doctors to automate their new prospects' journey to signing up. Thank you so much for tuning in today. Find out more about DPC, including resources, discounts, my favorite tech tools, books, and more at mydpcstory.com. The mapper has been updated so you can look for practices by specialty. Follow us on your social media platforms at our handle at mydpcstory, and be sure to subscribe to our newsletter and, of course, the podcast feed so you won't miss when the next episode drops. If you're also new to the podcast, check out the blog accompanying Dr. Boucher's episode at mydpcstory.com. With that, I am so excited to welcome our guest. Welcome to the podcast, Dr. Boucher.
Thank you so much. It feels like such a long time coming to get to talk with you on your podcast. And I could just go on and on about how much you helped so many pediatricians and family practice doctors and internal medicine doctors find out how to start their practices. And I am no different. I learned so much from you, and I'm so excited to get to chat.
I remember back to 2021 where you were still in fee-for-service and you were transitioning. I remember you messaged about the play-by-play. Hey, I sent out my letters to my families. This is happening. It's real. And you had quite a crazy practice where you went from nearly 3,000 patients to, here's my letter, folks, I'm doing DPC. So let's start there. What does nearly 3,000 patients mean to a doctor? And what does that look like on the day-to-day?
I mean, back then it would be anywhere from like 20 to 30 patients per day. So I don't know what the numerical math is. I won't try and do that live here. But it was 20 to 30 patients per day. And then there was an overflow. So we had PAs and nurse practitioners that were also seeing patients when our schedules were full. And it just was run. I mean, I was one that pioneered having a scribe so that I could just go faster and see more patients and keep my documentation. Like I had a scribe, he just graduated. My very first scribe was with me for 3 years. He probably saw 12,000 visits with me. So it was like such a fun medical experience for him. And we keep in touch. He just had a baby. He's an internal medicine intern right now, like seeing him go through that progress. But that takes me back to the days of I have to chart so efficiently, which means I have to have a person that wheels a little cart into the room with me so that he can document as we go. And I have a wave schedule where instead of seeing 4 patients per hour, if we have them show up at specific times, and I can actually squeeze a 5th patient in every hour. And so to go from that to DPC has just been an amazing journey. It's taken a lot for me to like slow down the pace of my clinic speed because I'm not in a hurry.
It is so true, especially for those of us who have already transitioned to DPC. It's such an interesting place to be in when you're like, oh, like I don't actually have to do this anymore. Like
Right.
I don't have to send the referral. I can actually talk to the patients and figure out more things just based on their history that they're sharing because I have the time to do it. So let me ask you there though, because we expect 5 to 10% of existing practices to transition to DPC. But for you, you're a pediatrician. Pediatricians are so invaluable as a mom to be a successful pediatrician. I'm sure that a lot of that has to do with relatability and
Right.
the level of comfort that you feel and trust that you have with your doctor. So can you talk to us about how you even approach that? Because you had so many all in one day, you had the person with the cart going with you. Like, how did you balance, this is what I went into medicine to do,
Right.
even before you transitioned to DPC?
I mean, I think there's lots of ways to be relatable in that quick period of time. And that was something that I was always teach students is like, there's studies that show that if you sit down, people think that you spend more time with them. And so even using like little hacks like that to make it you feel more relatable, we would have on the charts, like the mom's name, the dad's name, the sibling's name, the dog's name, those sorts of things. So you can remember that. Now we just remember those things because we have enough time and have so little patience to keep track of by comparison that it's easy to know the kids' names and where they go to school and the dog's name and all those sorts of things. But I think it's hard to feel like when you are seeing patients at that pace, that you're able to create those lasting connections and to understand where patients and their parents are coming from when it comes to the things that they're coming in for, because you don't know all of the context because you only have 11 to 12 minutes with them before you have to get on to the next one. It's hard to have those in-depth conversations. And I just found that over and over again, that really, when I was making a difference, it was in those really, I understand the context of your family and what you're facing and why you're concerned about this. And here's what I think that we should do based on those circumstances that if it was just a fly in, fly out, we would never have the time to talk through.
And especially when I have loved, and I think you and Dr. Deanna Barry said this on a podcast that you were on. It's so amazing to think about the pediatrician is actually not the doctor you go to when you're sick. The pediatrician is the doctor you go to toss, like, how is my kid's development? Can we do anything preventatively, knowing the mental health family history before this kid was born or whatever it is? But I think that it's definitely, especially pediatrics, primary care, the ability to work preventatively versus in these sick codes only that we have in fee for service. It's such an empowering place to be in. And I think we are definitely on the right side of history. So I love that you are on this journey with me and everyone else who's doing DPC. So tell us now, because you described it a little bit, like you felt like, how is this tenable going into the future? But what was it that created the perfect storm where you're like, peace out, man. I'm sending my letters today.
Oh my gosh. It was a perfect storm. I mean, I had kind of had inklings for a long time. I've been a podcast listener from the days when you had to plug in your old iPhone with all the little pins on the thing, and then you had to drag the podcast episodes from iTunes to the iPod and let go, and then hope that they made it across there, and then you'd have them on your little clickwheel iPod. So I've always been a big podcast listener, and actually your podcast, because I just found you through Facebook and all those sorts of things. And then there's a podcast called Healthcare Americana. Like those, I was just listening to podcasts. I was like, wait, this kind of makes sense. And wait, maybe this is more doable than I was thinking. And I kind of had a glimmer of that before the pandemic with, why are we pulling kids out of school to do these ADHD visits when we could just do it virtually? And I actually I piloted virtual ADHD visits with families before the pandemic, before everybody was on telehealth visits. And I was like, well, this is so much better. And then so many other like innovative things where it's like, this wasn't working. And the pandemic really just brought that to the surface of how can we be more innovative? Well, maybe we can do drive up flu clinics or drive up COVID clinics or whatever it might be. Why are we doing these things all the old ways? And so I had a lot of like innovative ideas and then a lot of pushback when it came to trying to innovate. And eventually I just said, I'm going to take my ball and go play in my own sandbox over here because it's just not working to continue to do what we're doing. And so there was a huge perfect storm, a lot of things that went into that, but that's how it all came to be. It was the worst time for a perfect storm. I turned in my letter to my practice that I was leaving 2 weeks before we were having our sixth child, who was a planned preterm birth, C-section, because of some pregnancy complications. And then 4 months before we were done building our house and moving into a brand new home. But it was just the time that it had to be. And it worked out okay. There's a coffee shop where I did so much of my DPC planning because I couldn't do it at my office. And I couldn't do it at home either because we have 6 kids. There's just not a lot of like work to be had at home. And so there's a coffee shop that I still go to. And I just think back to all the times that I spent time there, talking with different people, meeting, just sitting there and like designing a website and doing all the little things that you do when you're starting up. And so it was not the right time for the perfect storm, but it happened and made it through it. And a million other DPC doctors, like you figure out how to do all those things.
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes. So, reminder to the listeners, especially if you're new and you don't know this, I went to Nebraska for medical school. I went to Creighton, not UNMC, but anybody who is understanding of Nebraska culture at all will understand this. Go Big Red. You just did it, man, because that's the only way to do it in Nebraska. And I love that. And I think that's a gem also, though, just to mention how like you still have this place, this coffee shop that represents, this is where I was able to think differently. This is where I was able to be innovative. You know, I've been to the Elephant Cafe, I can't remember the exact name, but where J.K. Rowling wrote Harry Potter. And it's magical just to be in the foundational place where a DPC is born. And that doesn't have to be in a cafe. It could be in your living room.
Right.
But I think if you are out there and you are doing that, you're doing the dreaming and the planning for your DPC, take those freaking pictures, get your social media stuff already ready. And we're going to talk about why I'm saying that in particular for you, but you literally can use those pieces of, I feel like absolute crap today. I don't know what I'm doing. I don't know why I'm doing this. And then that can literally be your own personal reminder of this is the right thing. Like I am on the right side of history. I'm doing what's right for me and my family and my future. And that is what definitely Dr. Boucher and I have. So you went from this place of, okay, like I am trying, but I can't do it in this model. How else can I do it? Because you had 6 kids, because your house wasn't finished, because you were already a very established person with so many patients in a fee-for-service practice. Did you have any hesitancies that were pulling you back into the fee-for-service world? Or were you just seriously like, go Big Red, like I'm doing this, peace out, not looking back?
I don't even think I really considered it at the time. I mean, I've had like flashes since then of just, what if I just did fee-for-service? And then it takes like 5 seconds to snap out of that. But I don't even really think I considered it at that time of maybe the other thing is that I could open my own solo fee-for-service practice because of how the volume was and how the number of patients would have been in a fee-for-service model. Like I knew it would just be getting in over my head all by myself. And so that I didn't really consider that at the time. I didn't tell anybody when I was leaving that I was starting a DPC. Like that was not common knowledge before my letter went out that had the website, that then on the website they could find that information out. Like nobody knew that because I didn't want to be told, well, you can't do that. Or also like, that doesn't fly with us. We're not okay with that. And so I kept it a secret and a surprise and was just building in the background all of those things. And like you said, kind of like there's the memories at that coffee shop. This is where the DPC was born. And when I go there, I still get they have really good scotcheroos. I don't know if you probably remember scotcheroos. I don't know if those are a thing in the rest of the country, but those are still lasting memories of mine that I get to hold on to of here's where I went and here's what I did and here's how I built my practice. And I didn't even really consider at that time any other way and still wouldn't consider doing it any other way. And even when I'm having those difficult moments in the DPC world, I'm never like, I'm just going to pull the trigger and switch back over to fee for service because all of the hassles that we talk about ad nauseum that would result in making that switch back.
It literally is so sad when a person who dedicates their life to taking care of others cannot be free to do that. And you would rather have a different service job outside of medicine, anything else that allows you to just be you and to be able to relate to people as you need to. And most of the time, that requires time. We think about everyone has had an amazing customer service experience, and you think about what those things are. And one of the things that you mentioned is just the ability to be relatable. And like your ability to be relatable just exponentially changes when you're able to have the time you need with people. So when you were transitioning out of fee for service, when you were like already planning your DPC, did you ever consider having a consultant build your practice and you walk in? Did you go, oh yeah, I am looking for a particular space and could I join a primary care doctor's DPC as a pediatrician? Or did you only think about my practice, my building, my way, not going to have any ties to anything, but I'm doing it all?
I think I have a little bit of a side gig innovation background prior to starting my DPC. And so for me, it was, I'm just going to do it myself. Like I can figure this out. There's such good resources. There's such good community that I don't really need to do that. And I'm kind of like techie in a lot of the DPC stuff these days. There's a lot of like technical components to figuring out the website and the EMR and how it all links together and automates and all those sorts of things. And I like all that stuff. So to me, that wasn't something that I felt necessary. But I can certainly see how a busy pediatrician, family practice, internal medicine doctor who has a full plate at home and at work would want to be able to kind of turn the switch and move from what their fee for service into a DPC that they didn't have to like build from the ground up. So I can certainly see it both ways, or some kind of hybrid between those two where you have some help, you do some of the things on your own, but you get some help from other things. So I think whatever way works for you and whatever works for your current context is what makes the most sense for practice owners. And I think that you can do both super successfully.
Yeah. And that's the beauty of DPC is literally there's only one you and there's only one of your DPCs. So it's, and yes, there's people who will have MSOs doing DPC, but in terms of when I say you, like you have your panel of patients and you know them just like you talked about, like 600 is way less than 3,000. And if you're able to know them to the point of, I know you and your sister and your mom and your grandma, because everyone I've seen and met in person at this clinic or virtually whatever, but it's quite incredible how when you craft your clinic the way you need it to be crafted, it impacts everything else. What tech you choose, how you market, who you market to, everything. So let's talk about crafting your DPC. You had to pick a name. So how did you land on your name?
Oh, well, as a former Nebraskan yourself, there's all the ties to like the prairie. And I was kind of set on prairie pediatrics, but my wife or somebody that I was talking with thought that that was a little bit too difficult to say or harkened back a little bit too far to like the old fashioned days. I was kind of in that whole like mindset of old fashioned style / modern care. And so prairie was on the list. Pioneer was on the list, but that also kind of harkened back too far. And then I was driving by down the street where the clinic that I was at used to be at. There's a side street there and it was Frontier Road. And I saw that and I said, that's the word that I was looking for. was Frontier. So it's Frontier Pediatric Care. And so the Frontier part of it is really the fact that this is something new. We're in the frontier space in Nebraska, like in the prairie, where in the olden days it was the frontier land. And then that we're able to do something and trailblaze a new way for families that want something different. So that was kind of where the word frontier came from. And then pediatric care, rather than pediatrics, I think pediatric care, it was a little bit more all-encompassing for me because I knew I wanted to have some other things when it comes to therapy and other ways of providing care for families outside of specifically and only the pediatric healthcare component of it.
I love it. And now that you're going to be approaching your 3rd anniversary, which congratulations is awesome.
Thank you.
Tell us about your opening days because you had sent out letters, name had been chosen, your website's done. What was the opening week like for you?
So I kind of had I probably didn't need to do it this way, but my last day at my old practice was on December 30th because that was the Friday. And then January 2nd was open at my new location. I probably could have taken a little bit of time. And in retrospect, I should have just taken a little bit of time. Like my patients weren't going to go anywhere, but I felt like they had to have the continuity of care and it wasn't the most amicable breakup. And so there was some acrimony there. So I didn't want things to go sideways when it came to my patients' care. And so I wanted to be open that day. So a month before, my office manager, Corinne, started, and we started like literally building the furniture, putting all the pieces together, getting people pre-registered, all of those sorts of things. So on opening day, it was me, it was my office manager, Corinne, and then we had a nurse, Ariel, who was seeing patients and doing all the nurse things that one does on opening day when it comes to the staff for our practice. We opened with probably 115 to 150 somewhere in there patients that had pre-registered. And so day one was like, okay, we're ready to start seeing patients. I saw one actually the weekend before and we didn't even have furniture. So I just the grandma brought the twins in and we just stood in the empty exam room and checked their ears. And the grandma was like, this is the best thing ever. I can't believe that I just texted and you walked in and carried one of the kids from the car for me. And I was like, yeah, this is the right way to practice, even though it was like a completely empty room that I'm seeing kids in.
It just makes me think about Dr. Lauren Hughes, her massive space at Bloom Pediatrics and Lactation, a state away from you, had this open space. And I remember that multiple people have posted pictures of, what should I do with this? It's a lot of space. Like I've never had my own office. And it's so fun to see just the changes over time, but also that it's yours. Like you put those IKEA screws into the chair. It's like you did the Target building. Yeah, it's fantastic.
I have pictures of my kids helping me like actually build the furniture that we sit on and use in our office.
I love it. Because you had such a big buy-in from day one in your community, I want to ask about the patients coming in because clearly you're a pediatrician. You're the first doctor a kid is typically exposed to, right? And so did your patients come in saying like, I can't lose Dr. Boucher? Did your patients come in saying, I don't know about this membership, but I'll try it because it's a month-to-month option? Like, how did you find people willing to sign up so that on day one, you had over 100 patients?
Couple ways. One, I was able to make my way through the non-compete issues that plague physicians these days and was able to send a letter that said, here's my new practice, check it out, and those sorts of things. When patients were in the office too, like I let them know, hey, I'm leaving and you probably got a letter and you can check out the website and see if it's a good fit for you. And if you want to talk it through, whatever the case might be. Once I was done and my last day was done and my contract had been fulfilled, then I could start talking about it on social media. And I have a big social media audience. And so I was able to share like, this is what it looks like. This is the benefits. This is why it might be a good fit for your family. And those things help for people to be like, oh, okay, I guess that makes sense. I've never heard of this before. It seems kind of unusual. The membership fee, not taking insurance, all of those sorts of things. But a lot of my objections, we see laid out in the frequently asked questions on the website and the social media, and then doing lots of meet and greets. I think most people that were there on day one were patients of mine that decided to make the switch and come with me. And I think a lot of them were like, this sounds cool. It seems like something new. I'll have really much easier access to my physician, which is huge for me as a busy parent. I'm going to give it a try. It's not the end of the world if we have to switch in the future. Those have still been our most loyal patients that stick with us and say, I can't believe that this hasn't existed before. And so that was the makeup of the very first people. It was probably in the first few months, it was mostly my old patients finding me or deciding to make the switch or hearing from their friends that they wanted to make the switch. And now It's mostly not my old patients. We still actually, almost 3 years later, do have a trickle of old patients that said, yeah, finally, I like the last straw. There's all those sorts of words that you hear of, I just couldn't take it anymore, those sorts of things. Eventually, they decide, okay, it's worth it. I wish I had done it sooner, that sort of thing. But nowadays, it's mostly from the different ways that we market and interact, and people find us through word of mouth.
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited, customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad. Fantastic. And yeah, definitely that's, especially if you're a listener in the first 3 years, like that is definitely a thing where people will be back in your practice after not choosing you when you open. And then they're like,
Totally.
We've tried the circus of whatever exists in the community that's all based on sick codes, and then
Right.
can't do it anymore because I actually do value the ability to just text my doctor, send a portal message, and like they're actually there. This is exactly the culture that we have as a movement. And this is what people share when they are talking to their neighbors and their family members, like, oh yeah, I just sent Dr. Boucher a picture of my kid's eczema on his elbow, and I don't know if, what it, oh, hey, while I'm telling you about Dr. Boucher, he got back to me. That's amazing, right?
Yep.
And you don't have to go bankrupt to be able to afford that, which is incredible.
Right.
So your team, you opened with Ariel, you opened with Corinne and yourself. When you guys opened, you had that core team and you've grown since then. So who is approaching your 30-year anniversary? Who is on your team now?
So Corinne is still here. She's our office manager and leader. We have Kelsey, who's at our front desk and our member experience specialist. We have Clara, who's a part-time nurse practitioner who does a lot of breastfeeding work. She does primary care. She was from the pediatric ER before, and she does a lot of mental health work too. And then we have Lindsay, who's a PA, who's in our office and came from the allergist office in town. So she has lots of allergy experience, which has been fantastic to have. And she's getting her CLC as well because she wants to do more breastfeeding work. And then we have a part-time nurse. Ariel was with us, but then because of daycare changes with her family, she started working from home. And so we've been without a full-time nurse for about the past year. And honestly, it's just allowed us to have more time with our families because we just do the shots and the weighing ourselves. Christine, our part-time nurse, does a lot of the vaccine ordering and all of the different administrative things that it requires an RN to do. And then we have a mental health group that is associated with us that we consider part of our team because they're co-located in the same space and we share lots of patients with them.
And in terms of your growth over the years, at what point did you say like, hey, I actually do need another person seeing patients with me and finding out specifically what qualifications within that person or people going forward? How do you figure out what your clinic and your patients need as you bring on more people?
Right. I think for me, it was, Clara was the first hire that we had that was somebody that could see patients as well. And for me, it was waiting for the right person. And she was the right person by far with her breastfeeding background and being able to do in-home lactation consults. With her ER and previous to that, primary care experience, like she brought so much important and helpful knowledge to our team. And then with her mental health experience too, it was really waiting for the right person and finding that right person. That was about 6 months in when we brought Clara on board. And then as we've continued to grow, we have found, we need Kelsey at the front desk because we have patients coming in and Corinne can't do all of the office administrative work because she's constantly getting pulled. And Kelsey is a former Montessori teacher. She knows tons of people in the community. She's like the best first face when people walk in because she's so excited to see and help everybody. Those are the ways that we added, was really based on the person rather than we had this specific need. And that's allowed us to morph too. Not having an RN full time anymore was a change, but we've been able to adapt to that because we have the time to take on those roles and figure out how we can make sure that all the duties are being shared amongst the team.
And because you have a team of people who are working with you and keeping the patient's care going as an extension of your own doctoring, how did you bring these people on in terms of, did you offer W-2s up front? Did you do 1099s? Did you do internships? How did everybody come on contractually?
Everyone has been W-2s. Yep.
And financially, because I'm sure there's people out there who are like, what did I just hear? How did you do that financially?
We just got to the point where it was like, okay, it makes sense to be able to continue to expand our membership and to expand our membership offerings, that we should have more of the people, I guess, is the best way to answer that, is that we made sure that financially it made sense. And then we said, okay, if we add this person, how will this affect our ability to keep growing and also our incoming revenue? And if we're adding people that can see patients or have specific skill sets, then that's going to generate revenue in and of itself that will offset the cost of having people that can support the clinicians and the patients to grow. So I think it's both a complicated calculus and a simple calculus. It's complicated in, well, how much do we feel like this person is going to add from a financial revenue generator versus a cost perspective? But then at the end of the day, it's also, okay, we can't grow if we don't add to our team, and we want to grow.
Amazing. And just so relatable. And also, it just harkens back to when you have a DPC practice and it's membership based, you can predict what you're going to make in September, in October,
Totally.
in November. And it is so nice that you don't have to put into that equation, okay, and I know I've said this on the podcast and I continue to be snarky about this, but if CMS raises the rates for this,
Right,
then I will get more or less if they change it and lower the rates per reimbursement based on this code. So that goes away. You literally can just be like, 100 patients, this much per month.
Yeah.
This many patients. It's really simple. It's amazing. And yes, overhead, fine, but these are predictable things versus the unpredictability of when you don't have control over what your fees are even, right? Now, with the mindset of we want to grow our practice, we have the team that we're building along the way to be able to meet our patients' needs, provide amazing care, as well as grow the practice. You have had, like you mentioned, a very strong following on social media as you've continued. But bring us back to those days of when you didn't necessarily have the freedom to just go crazy on social media and post whatever you wanted to and what you needed to.
Right.
How did you have a workaround for that in terms of like, did you bank videos and then plan them to be released when you could be free to do social media? How did you cope with the restrictions that you were facing?
I think I like creating, like, that's a way for me to share and to fill my bucket. And so there's definitely okay, I can't post on social media right now because of the fact that I'm leaving my practice, but I can work and create things that are going to be evergreen. They're going to work in a year from now. And so they're going to work when I'm able to share again. And I can really craft those messages in a way that resonates. And I think that for physicians that are out there thinking, okay, I want to leave, but I want people to be able to find me, having an active social media presence before you ever put in your letter of resignation is a great way to do that. And it's not follow me so that you know where I go. It's follow me so that you can get good, helpful information. And then when I do go, and even if I can't keep up the conversation, you'll know where to find me because you already follow me and you already got lots of good information from me. So way before I ever considered leaving, I was creating on social media to educate parents about pediatric health stuff and parenting stuff. And so then I had to push pause, the natural thing was, well, where did he go? And then when I was able to start again, I was like, oh, there he is. Okay, got it. Oh, he's got a new clinic. So it was really easy to make that transition. And it was really helpful. And I always tell, there's a lot of physicians out there that are like 2 years away from leaving and starting their DPC. Get on right now. Just talk about educational stuff because your patients want to know about GLP-1s. They want to know about influenza. They want to know about COVID. They want to know about starting solid foods or potty training or whatever it is. Your patients are out there wanting to know those things, and you can just provide that good information. And then when it's time for you to leave, they'll know where to go look. They'll say, hey, I was seeing him talking about potty training. I need to go find him again. What's he doing? Oh, he's got this new clinic. Super easy way to really quickly have people find you, especially with all the restrictions that can come in when it comes to actually talking with patients about where you're going.
And that is definitely a journey that some of us have faced. You can listen to different ways that people have left their practices in fee-for-service. And it's really frustrating that it's like, when did this become a don't pee on my territory situation? Like, it's really sad because it has nothing to do with the patient's care. It's like about, you're our patients, even though we don't take good care of you. Doesn't make sense to me. So now, talking socials, one, I will say absolutely, I agree. Start as early as you can. If you have not yet signed a contract and you are doing fee-for-service, you are doing an employed position of any sort, definitely make sure that nobody else owns your socials, that you can have your social media platform. But also, when you start early, I love going back to even my first interview for this podcast with Dr. Niti Kapoor in Fayetteville, North Carolina. I'm like, this is my DPC. My tonation was so flat. You get practice the more and more you do stuff. And so if you practice, and hardly anyone goes down to the bottom of a person's feet if they've had 2 years of social media, but literally it's you also getting to feel like what works for you, what's comfortable, how much time does it take? And you definitely, as a person doing social media, I would love if you can drop some top level tips for people who are in that space of, oh, I didn't think that I needed a social media platform. Cool. I'm open ears. I could see myself doing more. Or for the people who are like, I'd love to do more of it, but I just don't know the details of like, how much time does it take or whatnot. And this is definitely a loaded question because I know you are amazing at marketing and social media. But in terms of, for those people in particular, what are like some top 3 tips that you would tell those people who are just getting started in social media in terms of how to do it?
How to do it is to answer specific questions and get as granular as you can on the questions, because people want to know, especially on social media, really short, tiny snippets of information. And that is all they have the attention span to consume. And so instead of how to start solid foods, which is all sorts of things. I mean, it's actually rather easy, but we make it hard. But instead of how to start solid foods, it's how to start peanut with your child. And so give that really quick thing that you can say in 30 seconds that you say to patients all day long without even thinking about it. Just share those micro pieces of content over and over and over again. And you'll get really good at talking about them because you already know exactly what to say because you say it all day long. And be authentic with the way that you say it. And authentic to me is not the bright lights, backgrounds, perfect settings, and all those sorts of things. It's pulling out your phone and just doing it like this and starting with, are you wondering how to start solid foods? I'm specifically hearing from a lot of people that they're confused about starting peanut. And so that's all you have to do to catch people's attention. And if they see that in the background, you're recording this in your car, and there's Cheerios all over the car seat, which I have a car seat and it has a lot of Cheerios in it too. This is such a great way to make people feel authentic and relatable to you as a human being. It's so much better than like hey, you should use sunscreen or something like that. Just share really specific micro nuggets of information and put it out there. And like you said, it does not have to be perfect. And you have to keep in mind that people have such limited attention spans that they're going to watch the first 5 seconds of your video and then they're going to keep flipping. And you have to see a lot of pieces of information that you're providing before they're actually going to pause and watch 30 seconds of your video. I have tons of videos that have like millions of views. And when I look at the audience retention, even my best videos where I have millions of views, the audience retention is like this. Like it drops off so quickly. So say one really tiny important thing at the beginning and then expect that nobody's going to watch it to the end, even if it's the most brilliant things that you have, which means you can just keep putting out stuff over and over and over again and reusing it so that you can get more bang for your buck and just little micro content. So that was kind of long-winded. Micro content, be authentic, cameras and all the things that set up that make it hard to do. And my experience was the same as yours. Like my very first video is on YouTube and it's how to start peanuts with your baby. And I filmed it in my kitchen. It took probably 3 hours to film a 2-minute video on just give them some peanut butter. But it's fun to look back at that and see how far you come when you just consistently practice.
And definitely, if you are boggled by that, like, what do you mean they don't watch the entire video? On YouTube, a very visual platform where you go there to expect to watch videos, average duration of watch time is like a minute. And so when you're making a 1.5 hour video and you're like, wow, people like listen to my talk about whatever it is for 7 minutes, give yourself a high five. That is amazing. So it is not like they didn't watch 60, they didn't watch 100% of it. They watched 7 times a normal attention span of YouTube watchers. So it's definitely something that there are so many ways to think about life. We think about them very analytically, especially as doctors, but it's 100% is not what we're going for anymore. And, one more big tip about social media. You definitely are a person I think of when it comes to this. Dr. Lauren Hughes is a person who I think of when I think of this. You guys are also educating the entire country and the globe, like whoever follows your pages, about what direct primary care is. And so I think that it's an amazing way to help everybody when they're like, what is this thing? Oh, Dr. Boucher's in Nebraska. Like, I'm all the way here in North Carolina. Are there any other doctors like him? And that's exactly what happens. People are like, what is this direct primary care? And then they Google it and then they find doctors near them. It's amazing the way that it helps the movement as a whole when people are participating in social media. And because it adds to our patients and potential patients understanding, it also helps with our own marketing in our individual practices because we don't necessarily have to break down what does direct primary care mean. So,
I do get a lot of DMs of like, is there somebody like you in Hoboken or wherever? And then I always try and point them to all the different mappers out there and everything like that so that they can find it. And I do get to hear from physicians and from patients that like, hey, I switched and I found a doctor because of you that was in direct primary care. So it feels really good to help support the movement when I'm just like, at the end of the day, trying to educate parents, but also draw more patients into my practice that it helps other practices too.
Love it. Now let's talk pricing because pediatric direct primary care is definitely an amazingly fast growing movement because you guys are just as done with the fee for service system as every other specialty. But when it comes to pricing, this is where some people, especially in pediatrics, are like, how would I even price that? Because you have your periodic monthly visits in the first year. And then typically people are so used to, again, like I mentioned earlier, only going to the doctor, including pediatricians, when they're sick rather than like doing preventative stuff. So how did you think about pricing at your practice?
When we were looking at pricing, luckily I was really involved in coding and finance and the books and everything for my entire pediatrician career. And so I had a good sense of what are people actually paying out of pocket on a yearly basis for their pediatric care. I want to meet that. And then I want to add all the other features, the text messaging, the ease of access, the unlimited visits, the small clinic, the booking the appointments online, all those nice features that we can bring to the table in direct primary care as just gravy. And so that was kind of the basis for, okay, what's the average patient? What is the average teacher or nurse or single parent paying on a yearly basis for their pediatric care out of pocket? How can I match that? Because people assume that their healthcare is free as long as they do it at their checkups and you don't ask too many questions because then you'll get the 25 modifier code or something along those lines. So they don't want to pay a lot extra. So it's a lot of educating them on that. And then we set our prices to reflect that. Newborns in the first year of life is the most expensive. And then it gradually tiers down to our school-age kids. And so newborns are $175 per month. School-age kids are $85 per month. Everyone else is between there. And that allows us to, as you said, take care of those babies that have a lot of healthcare needs, but also take care of the 6-year-olds and the 16-year-olds who come in very infrequently to make it seem, okay, the math still adds up. Like this is valuable for me to have access to my pediatrician in this way and to have a clinic like this, despite the fact that my 16-year-old doesn't come in all that often.
And even with all of this business knowledge of what a patient is expected to pay or is paying in fee for service, it misses sometimes, the amount of money I lost because I had to take off of work to take the kid to the doctor.
Right.
Or, the medicine that I bought at Rite Aid or CVS that I could have gotten out of my pediatrician's office for like literally 20 cents.
Right.
Or like the ER visit that I went to when I didn't need to go to the ER because I had no other access. And I could have just texted my doctor because it's not actually an emergency, but I didn't have any access. So there's so many uncalculated costs that parents, myself included, don't think about until you hear these stories of, do you know that because I'm a member at your practice, I didn't have to go to the ER? Or because I'm a member at your practice, I didn't have to pick up the 4 kids at different daycares or schools all over town to bring them because they didn't have anyone to pick them up after school to make this appointment for the one kid. It's just so amazing that it literally, direct primary care builds our practices around our patients' needs. And that is individualized for every single community that you and I and everyone else is practicing in. So when we talk about personalizing the services at your practice, you've definitely done that to a T. Tell us about what can a patient expect who is already a member? And then what do you offer that brings new members in?
I think for those that are members, I mean, all the typical DPC offerings of the unlimited visits, the ease of access, the online booking, the small clinic feel, like all of those things that we all know. When it comes to non-members, there's a bunch of different things that we've started to offer, and it's really been in response to the needs of the community that have come up. For one, we do some cool things like autism evals, which I never thought that I would get to do, and that's actually probably my favorite thing to do is get to do autism evals in the community. Got training on how to do that and get to do those because there's a huge community need there is around the country for getting autism evals done in a timely manner. We do mental health care for families that want a higher touch mental health access. And so they're kind of sick of just getting the refill visits and refill visits and refill visits and want a little bit more for their child's ADHD, anxiety, depression. They want the ease of access to that comes from sometimes you just need to say, this dose is working well. We're in a good place right now. Can you send in a refill without having us to have take off work and take off school to come in for those visits? So we're able to pair those things together too. Ear piercings is one that we love doing. And we do a lot of ear piercings because it's just something that people know us for and we like doing them. They're fun. And it's a good way to offer something to get people and foot traffic into the office, honestly, because then they come in, they see how nice we are. They see how easy it is. They see how they didn't have to wait 45 minutes to get in and get seen and get their care needs taken care of. It just makes for a very fun opportunity to get them into the office. Those are some of the big additional services. We do one-time visits too. We don't do a ton of those because I think a lot of people have just been trained to go to urgent care for those, but we do definitely offer those and make it really easy for people that want to. And a lot of those do end up eventually converting into members because they realize, oh, I was able to get in. I booked my appointment online. It didn't take 45 minutes of waiting before I was able to see the doctor for 2 minutes. They helped me out and then they checked in the next day. And wow, totally different experience. That's primarily why we do that, is to help in the community with the need of sick patients, but also to generate the opportunity to share about our practice with people that haven't found us yet or haven't experienced it yet, and then show them what it's like to be a member in our practice.
Love it. And just really, again, going back to what is needed and what isn't always delivered as a patient needs, especially with an in-person option. We see so many virtual companies popping up, and that's fine. It works for people, but It is so nice to have a doctor who is there also if you have a cough or just a full scope. Clearly, I'm a family doctor. I'm like, yes, we do it all because that's what we love and what we train for. So I love that you have really honed in on what your community can benefit from. Now, when I think about everything that you've shared, you're approaching your 3rd year anniversary. A big question I want to ask is, how would you describe how DPC has truly changed your life now that you're almost 3 years into this journey?
I think time is the biggest thing for me that's really changed. It's the number one thing for physicians in general that they say they don't have enough of. And so for me, time is time with my patients, as we've talked about, like having the time to talk through, to get to know them, to add on the other child that actually is the one that they have concerns about when they come in for their 2-month well child check, but they really want to talk about their toddler that's having a lot of difficult moments with the new baby at home. Having time for our patients, having time for our staff and our team. Like, we get to meet every morning as a team. We huddle, we talk through the patients, we talk about our lives and all the other things that are going on. Having the time to really embrace that team-based approach for care for my family, just to know that, okay, I leave here every day at 4:30, 4:35, and there's no patients that we've told, we don't have time for you. You have to wait till tomorrow. You got to go to urgent care. Like, we leave with a clean slate every single day for 3 years without exception. And I get to go home and I get to make dinner with my kids and then have an evening with the kids without having to worry about doing a bunch of charts or a bunch of notes all evening, having all of those things that would otherwise be on my mind and like distracting me. Being able to care for patients in that way too, like text messaging, has actually given me a lot more time with my patients that need me and with my family too, because there's a lot of things where we don't have to have them come into the office. So another way for time is actually being able to be in closer contact with patients. And then for all my side projects and side businesses that I have too, like that is something I like to innovate and try new things and fail at a lot of things and experiment and see what works and what doesn't work. And I did not have time for that or encouragement for that when I was in my traditional fee-for-service practice. Like that wasn't something that I could do, but it's something that really fills my bucket. It allows me to help others, and it allows me to stretch my creativity and innovation muscles in a lot of different ways. I think the other thing that's really changed is the ability to innovate and respond to the local needs. We talked about autism, evaluations, and those sort of things that we're able to do. But when we first opened, like COVID was still rare and causing a lot of difficulties. And we were able to give N95s to teachers because the teachers didn't have N95s. And so we were able to do that before. We didn't have the ability to do that, but we had N95s that we could have teachers come in and grab them when we were in the thick of it. The formula shortage occurred shortly after we were open. We were able in 3 days as a team to set up a formula library where people have lots of formula on their shelves that they weren't using. They could drop it off. People that needed formula could come and get it. I mean, there was no charge or anything like that. It was just free will offerings of formula. So we were able to make those connections in just an easy way where things didn't die in committees and meetings and approvals and all those sorts of things. We said, there's a lot of patients out there that need formula and we can do something about it. So let's do something about it. The pharmacy that we started so that we were able to innovate and give people the ease of access to getting their medicines without having to go wait at Walgreens or CVS and play pharmacy tag with their sick kid. All of those sorts of things have just been what has really changed my life when it comes to what DPC has provided.
And truly, it is because this movement exists and this movement is real. It's not a magical unicorn. There are people like you're approaching your 3rd-year anniversary. I'm like days away from mine at the time of this recording. And it's just like the time flies no matter what you're doing. So why not do it in DPC?
Amen.
So let's hear your next 3 years. What do you see happening at your DPC?
Oh, that's a great question. I'm always thinking in the future. I really like some of the neglected areas of medicine and pediatrics where there's a lot of community and parent need, but not a lot of help and support. We're able to have our therapists in our practice, which gives us the ability to really look at the whole child. And one subpopulation that really has sparked my interest and passion in the past few years is patients with PANS and PANDAS. They're often neglected or mistreated by the healthcare community. And to be able to help them is one thing that I'm really interested in. And I feel like we have a really good team approach. And we have some local retired experts that are able to help us to really set up something for the PANDAS community locally, which there aren't a lot of options for them. I do like the idea of more virtual care as a complement for patients that need more touch points, but are not nearby a direct primary care practice. And so within our state, there's a lot of healthcare needs that we can fill and be a way to help educate, to reassure, to provide medical care virtually that we can do. So that's something that's on my horizon. And then I really like helping the movement and helping other DPC doctors to get started and to grow their practices. And teaching has always been a thing for me. And I love getting to teach in my practice the parents. I love getting to teach residents and medical students. And I love getting to teach fellow physicians. I was actually an MCAT teacher for Kaplan while I was in my senior year of college and then my first few years of medical school, and got to teach a lot of my colleagues now that are in the community. And I see a lot of their kids actually in my practice. They were like my MCAT students. And so I've always had a passion for teaching. And so being able to teach fellow physicians in particular how to grow, market, make their businesses thrive is something that is really a passion of mine too.
Fantastic. I think this is also part of the part that makes me feel so alive is we're part of a community where people are doing this. It's like we can do other things that are not just going in and talking to other people. It's wonderful to be a doctor, but it's also wonderful to be present with your kid. It's wonderful to be able to, like you've done, have the support and have the time to do things that are outside of medicine. That's amazing. So that is a wrap for today's episode. Definitely, especially if you are in pediatrics or you're new to the DPC space and want to get to the soonest conference possible, check out pediatricdpcmastermind.com. I hope to see Dr. Boucher, Dr. Barry, Dr. Coleman, all of these amazing pediatricians in California. That's where it's supposed to be in February of next year, 2025. So definitely check out that website and just set Google alarms to periodically check it or sign up for notifications. It's an amazing event, especially for pediatricians to be around other pediatricians. When I went to the very first one, there was a lot of people in the room who were like, I just don't see how I could actively do this. And that is where you can do on the grounds networking and learning about like, how do you put the wheels in motion to really start your pediatric DPC, especially. So again, pediatricdpcmastermind.com. If you have enjoyed Dr. Boucher's story, definitely come join us on our exclusive Patreon feed, where we're going to be talking even further about how he works with his team, how he keeps them staying nimble, how he keeps them working effectively together, and how he streamlines the team effort to make sure that everyone is on the same page and maintaining the quality of care at Frontier Pediatric Care. You can find the Patreon link on our homepage and at mydpcstory.com. Thank you so much, Dr. Boucher, for joining us today and sharing your story.
Thank you. It's been so much fun.
Thank you for joining us for another episode of My DPC Story, highlighting the physician experience in the world of direct primary care. I hope you found today's conversation insightful and inspiring. If you want to dive deeper into the direct primary care movement, consider joining our My DPC Story Patreon community. Here, you'll have access to exclusive content, including more interview topics and much more. Don't forget to subscribe to My DPC Story on your podcast feed and follow us on social media as well. If you're able, I'd greatly appreciate if you could leave us a review. It helps others to find the podcast. Until next time, stay informed, stay healthy, and keep advocating for DPC. Read more about DPC news on the daily at dpcnews.com. Until next week, this is Marielle Concepcion.